This is vital and critical information because PCOS has now had a name change to PMOS. What used to be polycystic ovarian syndrome is now polyendocrine metabolic syndrome. What is the main difference between the two? I'll quickly explain. PCOS suggests that there are cysts in the ovaries, but now modern research scans and ultrasounds are confirming that what appears to be cysts are in fact arrested eggs or immature follicles in the ovaries. And now this new name change to polyendocrine metabolic syndrome, which confirms that it's more than just cysts in the ovaries. It is in fact polyendocrine. It involves your hormone system. It involves metabolism. So we're not just speaking about fertility and reproduction, which is good for traditional Chinese medicine practitioners and our patients because we have been saying this for such a long time. When you look at a condition, a syndrome which has multiple symptoms, it's not just one aspect. You need to look at the whole entire body. And this confirms that there are multiple diagnoses and multiple reasons as to why a patient would have PCOS or PMOS. In traditional Chinese medicine, the definition of PCOS has been up until now that it is a qi and blood stagnation problem, even though the medical terminology of traditional Chinese medicine and Western medicine may slightly differ. Traditional Chinese medicine has been treating PCOS as though it is a polyendocrine metabolic syndrome for thousands of years, addressing multiple vital organs that have been affected, which include the spleen, liver, kidney, which gives rise to qi and blood stagnation and dampness and phlegm heat, which are seen in PCOS. Traditional Chinese medicine has been offering a multi-layered approach to diagnosing a health condition for thousands of years. And so when you come to a TCM practitioner like us at AcuLife, we address everything from energy, pain, digestion, fertility, menstruation, trauma, sleep. All this needs to be addressed for us to properly diagnose a health condition, because two patients can have the same diagnosis of PCOS or PMOS. However, their symptoms and internal conditions may be different. So we need to treat them specific to their health needs. PCOS affects 1 in 8 women. And what's most disheartening is that many women have been poorly and incorrectly diagnosed. And in turn, many women have not been able to fall pregnant, which can lead to even more emotional strain, mental anguish, and trauma. So if you've been diagnosed with PCOS, come for an initial consultation so we can address your health concerns holistically and thoroughly.